Now let's discuss some of the cons to becoming a public health nurse. The first one we're going to discuss is the poor community health. Whether you're working in a rural area or in an impoverished urban neighborhood, public health nurses often help those with serious health problems. In rural areas, the remoteness and other factors of geography and culture lead to residents having fewer quality healthcare interactions and having worse health outcomes than people living in more populated areas. In impoverished urban areas, environmental pollutants, poor nutrition, and the inability to afford healthcare lead to a myriad of health problems, particularly in children. As a nurse working in these communities, you have to be prepared to address preventative care and systemic barriers to health and help the community members who may be suffering from multiple acute and chronic conditions. The second con would be limited resources. In both rural and impoverished urban communities, health resources are often very scarce. The community itself may lack funds, and nonprofits and public health departments do not typically have very expansive budgets. This could lead to a PHN facing a number of challenges, just trying to do their job. You may lack the space to provide clinical service, you may be short on supplies for providing treatments and creating educational materials, and you may not have much in the way of staff or other assistance. The last con would be it is a lot of work. It is not easy to turn around the health of a community that has traditionally suffered from poor health. A lot has to be done to remove barriers to healthcare, improve environmental conditions, and help the community learn healthy behaviors. It can take years before there's a measurable improvement in the community's health, and even then there will be likely a long climb ahead. There's never ending when it comes to public health needs. At times the situation can seem intractable, and for you to succeed as a public health nurse in these settings, you have to be patient and understand that it will take lots of work and meaningful progress.